Hello everyone. Today I'm going to be talking about telehealth and how it affects interpersonal communication between healthcare providers and patients. I'll specifically be focusing on nonverbal communication and interpersonal perception and how these concepts change when healthcare interactions take place through virtual platforms instead of in person. Telehealth refers to healthcare services that are delivered remotely through video calls or online platforms rather than traditional in-person visits. Its use increased significantly during the COVID-19 pandemic when healthcare providers needed safer ways to continue caring for patients. Today, telehealth is commonly used for therapy sessions, primary care visits, and rehabilitation services. While telehealth improves access to care and convenience for many patients, it also changes how communication happens between providers and patients. According to the U.S. Department of Health and Human Services, telehealth use increased rapidly during the pandemic as healthcare systems adapted to remote care. Today, I will discuss how telehealth affects interpersonal communication by changing nonverbal communication and interpersonal perception. First, I'll explain nonverbal communication and how it functions in healthcare settings, and then I'll explain interpersonal perception and how impressions are formed during telehealth visits. Nonverbal communication refers to communication that occurs without spoken words. This includes facial expressions, eye contact, posture, gestures, and physical touch. In healthcare settings, nonverbal communication is especially important because it helps build trust and makes patients feel comfortable. For example, a provider might use eye contact and nodding to show they are listening, or use a reassuring touch to help a patient feel supported during a difficult moment. These nonverbal cues help patients feel understood and cared for, which is an important part of effective interpersonal communication. As discussed in communication in the real world, nonverbal communication plays a major role in how people interpret messages during interpersonal interactions. In telehealth settings, many of these nonverbal cues are reduced or completely missing. For example, the camera may only show a provider's face, which makes it difficult to observe full body posture or movement. This is especially important in areas like physical therapy, where observing body mechanics and movement patterns is essential. Physical touch, which is often used to provide reassurance or guide movement, is also completely removed in telehealth. In addition, small delays in video or audio can make responses seem less natural, which may cause patients to feel like the provider is distracted or not fully engaged. Because nonverbal communication helps express empathy and attentiveness, losing these cues can make interactions feel less personal even when the provider is communicating effectively. As a result, providers often have to rely more on clear verbal communication and intentional behaviors, such as maintaining eye contact with the camera to make sure patients feel supported. Interpersonal perception refers to how people form impressions and make judgments about others during interactions. In healthcare, patients often form opinions about a provider's competence, professionalism, and empathy very quickly. These perceptions are influenced by communication behaviors such as tone of voice, responsiveness, and nonverbal cues. For example, if a provider appears attentive and engaged, patients are more likely to feel comfortable and trust their care. These first impressions are important because they can shape how the rest of the interaction develops and how willing a patient is to communicate openly. In telehealth, interpersonal perception can be strongly influenced by technology and the virtual environment. For example, poor lighting, a distracting background, or technical issues like lagging video can make a provider appear less professional or less attentive, even if that is not the case. Patients may also interpret a lack of eye contact due to looking at the screen instead of the camera as disinterest. On the other hand, providers may misinterpret a patient's behavior, such as limited facial expression or delayed responses, as disengagement. These perceptions matter because once an impression is formed, it can influence how comfortable patients feel communicating and how much trust they place in the provider during future interactions. Research from the American Medical Association suggests that communication quality strongly influences patient satisfaction during virtual healthcare visits. In conclusion, telehealth has made healthcare more accessible, but it has also changed how interpersonal communication occurs between providers and patients. Nonverbal communication cues are reduced, and interpersonal perceptions are often influenced by technology rather than in-person interaction. As telehealth continues to grow, especially in areas like rehabilitation and physical therapy, understanding these communication changes will be important for maintaining strong and effective patient-provider relationships. Thank you for listening to my presentation on telehealth and interpersonal communication.